Hello, my name is Ashley Hawthorne. I'm a student nurse practitioner. Today we'll be doing a musculoskeletal assessment on your lower extremities. So starting off, we're going to assess your gait. So I'm going to have you stand up and I'll have you just walk normally front and then walk backwards. And then I'm going to have you walk on your tippy toes forwards. And then turn around, and on your way back you can do walking on your heels. And then turn around and I'll be walking on like the outsides of your feet. Okay. Go ahead and have a seat for me. So now we're going to be looking at the symmetry of the legs. So the legs appear symmetrical when just looking at them. The thighs are symmetrical muscle tones, the knees are symmetrical, ankles are symmetrical, and there's no gross deformities occurring. There aren't any major calluses or corns on the feet, and there's no signs of swelling. Next, we're going to be doing the palpation of bony landmarks. So we're going to start off at the iliac crest. So I'm just going to move your arms to the side, and we're going to feel the anterior and posterior iliac crests, the greater tubernacle of the femur. Next, we're going to palpate the patellas. So we're going to start off at the top of the patellas and move down. And we want to feel the top of the tibia and down into the ankle and the Achilles tendon and the tarsals and the feet, and squeezing the feet. And everything is symmetrical with no signs of swelling or deformity. There wasn't any bogginess anywhere or any signs of swelling. So next I'm going to have you lay down on your back, and we're going to do range of motion on your hips. So first I'm going to have you bring your knee to your stomach. Good. And then go and put that one down and bring your other knee up. All right, and I'm going to have you roll over on your stomach, and I'm going to do the extension of the hips. So just like lift your leg up. Good, and then the other one. All right, and then go ahead and flip back over. And now we're going to do the abduction and adduction. So with your legs straight, bring your leg outward. And then the other one. Okay. And next we're going to bring this foot up and over to where you're kind of crossing your leg. And then with the other one. And now you're going to kind of bring it outward with it. Okay. And then the other one. Okay. Next we're going to do the knees, so you can go ahead and sit back up. So they're currently in a flex state, so we're going to then extend them out. Good. And then I'm going to have you kind of bring them side to side. Go ahead and flex them back down, and then bring them side to side. Good. Next, we're going to do the ankles. So I'm going to have you flex them forward and then up towards the ceiling, and then kind of rotate them side to side. Good. And then we're going to do the toes. Flex your toes down, and then extend them back out. And next, we're going to do these special tests. So with the knees, we're going to check for the bulge sign and for any ballooning. So for the bulge sign, we're going to palpate any fluids downward and feel for any bulging at the bottom. And then for the balloon sign, this would be for major effusion. We bring all the way around and push, and there's no effusion occurring on either knee. So next we're going to check the McMurray sign. So I'm going to have you lay back down. And for this one, we're going to bring it in, and we're going to internally and externally rotate it. And then the other one. And this one's checking the meniscus. Next, we're going to do the valgus and vargus for the ligaments. So we're going to push inwardly on the knee, we'll push pushing outwardly on the tibia, and then the opposite. Is there any pain with that?
No.
Okay. And next we're going to do the drawer test. So I'm going to have you bring them up a little bit, keep your knees flat, and we're going to pull out on your knees, and pull, push in, and there's no popping or any tenderness with that. Next we're going to do the Latchman test, similar to the valgus. We're going to push on the femur instead. Alright, and next we're going to check the ankle drawers. So we're going to push inwardly on the ankle, and then with this one. Okay, and that's it.